The famous Chinese proverb is a word of comfort in the left ear of a patient makes the medication work so much better.
When people walk in this hospital, the first thing that happens is they're greeted by one of our wonderful volunteers. When visitors come through or patients come through, the minute they look kind of lost, or even if they don't look lost, if you're there, it doesn't matter if it's me, Farron, Ruben, if it's one of the nurses here, they're going to say, "Can I help you? Is there someplace I can help?" And we don't direct them down the path, we walk with them.
We're going to take them where they need to go and never say, "That's not my job." That is my job, to make this hospital that quality.
You're able to move quickly. You're able to make positive changes quickly. That's very important to a really dynamic team like the ED.
It's amazing when you walk through the hospital and the CNO knows the names of the staff on the floor.
We're on the 97th percentile nationally for the most overall engaged and enthusiastic employees.
Everybody knows each other here, and we all work together like a family.
I look forward to getting up and coming here. It makes me feel good. I go home feeling warm-hearted.
It's a hospital-acquired condition that's good to have, that everybody smiles, and it kind of rubs off on everybody else.
We have hired excellent staff. We work on hiring the most competent, but yet the right attitude for our hospital. That makes a difference, and word gets around.
We want to make sure that we're being compared to the very best and that we're meeting or exceeding those expectations on quality.
I think that means more than just do they leave here healthier than they came in, but do they leave understanding more about their health? Do they leave feeling like they were well taken care of and their concerns were met while they were here? All of that leads to what I would call quality at a hospital.
How do we give a patient a positive experience while they're here?
I put myself in the patient's shoes and think about what I would want to see. When they're laying in that room and there's no staff with them, they're looking around the room at everything, and I want it to look spotless clean.
The small steps that if we do those correctly, we do those well, then the outcome falls into place almost naturally.
We know that when people come to the emergency department, they don't want to wait all day to see the physician. So our goal is to make sure that every patient's being seen by a provider within 30 minutes.
The whole staff, and frankly the patients, can see how we're doing. If you go upstairs to our inpatient unit, come off the elevator, right there is the board with some of those results. We are not shy about it. When they're great, we're excited to share them, and when they take a dip, then everybody shares in the disappointment and gathers up and says, okay, how are we going to bring this number back up?
What are the barriers? What are ideas that we might throw out there, even if they don't sound conventional?
It's easy for me to say as the director, this needs to be done and this is how I want you to do it. But I also remember being a staff nurse, and I also remember people at the top making decisions that didn't work for me, didn't work for my coworkers.
Let's have the frontline staff decide what are the best methods for caring for patients. What can we do about that? Well, at the time, hourly rounding was this idea that would improve patient satisfaction. So the staff looked at, well, how can we do that? How can we document it? And just going into a room every hour does not achieve improved patient experience. It's what do you do once you're in the room? So it's what they said to them. So they were very specific decided to ask about things that were obvious to the patient on their surveys. How's your pain? Are we doing everything we can do to manage your pain? Do you need to go to the bathroom? You know, we want to prevent falls. And are you in a comfortable position? Do you need another pillow? Do you need a blanket? And finally, before they left the room, they said, is there anything else I can do for you? I have the time. The perception of the patient is they weren't just coming in every hour, they were coming in a few times per hour. They felt that they were really getting that kind of attention. That's innovation. We started what's called the sacred moment. So when patients come into the hospital, they enter the emergency room, the operating area, or the inpatient area. They're asked, what is your greatest concern or fear?
A lot of times what we think is their biggest concern turns out to be something completely different.
Before we begin to do anything medically related, we ask them for any fears or concerns, any anxieties they have today, and we try to address those.
Staff thought it would take them more time. You know, they're rushing to get people ready for surgery. What they found was they humanized the experience. They found that they made more eye contact, and guess what? It didn't take any more time.
We have to measure our success. You know, anecdotal evidence, stories, gut feelings are all important, but if you can't measure it, it's tough to say something happened.
For me, the Zia Award is confirmation of what we already knew, that we're giving very high quality care, that we're focused on quality initiatives, and that we're focused on delivering the very best to our patients.
And the journey was rewarding in itself, but it's really just the first milestone in a lifelong journey of quality.
There's a passion that I haven't felt in any other organization in regard to quality and our patients. The focus is always on the patient, and that is where it should be.
Yeah.